COVID-19 hospitalizations still in the triple digits, health officials continuing to urge Bahamians to get vaccinated, and the PLP holding a virtual rally last night. Good evening, everyone. I'm Lissy Bastian with your Jcn News for this Friday, September 10th. Thanks for staying with us. We begin tonight's newscast with our national COVID-19 update. COVID-19 hospitalizations on the rise, with the Ministry of Health confirming a whopping 188 people now in hospital with the virus. The Princess Margaret Hospital topping the list with 106 cases, Doctors Hospital with 47 cases, Grand Bahama 26, and the South Beach Acute Care and Referral Center with 9 cases. 165 in total are considered moderately ill, while 23 patients battle the virus in intensive care. Now, health officials also confirming 196 COVID cases over the last 2 days. According to the most recent COVID-19 reports from the Ministry of Health, 136 were confirmed for Wednesday, September 8th, and 60 confirmed for Thursday, September 9th. 167 confirmed here in the capital over those 2 days, 15 over on Grand Bahama, 5 on Abaco, 1 on Bimini and Cat Key, 3 on Eleuthera, 4 on Exuma, and 1 case on Andros. The national count now stands at 19,335, 3,205 of which are active cases. 385 recoveries were also reported over the last 2 days, pushing total recoveries to 15,557. The death toll remains at 453. With the more transmissible Delta variant confirmed in country, and with more than 150 people in hospital and COVID-19 cases continuing to increase, health officials continue to urge the public to get the COVID-19 jab. The Public Hospitals Authority addressing the critical status update on the impact of COVID-19 in public health care facilities. Our Tyler Simonette has more.
The Public Hospitals Authority renewing their call for the public to get vaccinated against COVID-19, as the healthcare system in the entire Commonwealth of the Bahamas remains severely challenged during the ongoing pandemic. During a press conference held on the critical status update on the impact of COVID-19 on PHA institutions, Princess Margaret Hospital's Administrator Mary Lightburn Walker says that the public can assist in this ongoing fight.
We all must do our part. We all must have patience for one another. Yes, it is imperative that we continue to do all of the COVID safety protocols that have been in place to ensure the safety of all as citizens in the Commonwealth of the Bahamas. It will ensure that our healthcare providers are in a place where they can provide that care and not be impacted by an overabundance of persons presenting. We must all mask. We must all social distance. We must all sanitize. And more importantly, be immunized. That's the only way that we can control what is happening in our country and be manageable for the healthcare providers in the country.
PHA Chairman Julian Rowe painting a grim picture of what's going on in the healthcare system, as he says Bahamians are in the fight of their lives against the battle of COVID-19.
The COVID positivity rate is 39%, which is an increase from 7.3% in June. The number of available hospital beds in PMH is 79. All of the public hospital institutions and the entire healthcare system in the Bahamas is overburdened due to the continuing rise in COVID patients requiring tertiary and primary care. This unprecedented stress directly results from the ongoing surge in virus, which is more easily communicable even among young people than it was before, posing a greater risk to those with conditions such as diabetes and heart disease. Thus, the death rate among the COVID-infected persons continues to rise, especially vaccinated. COVID-19 is real. It's here. It's deadly.
Dr. Karen Rowe, an anesthesiologist who forms part of the critical care COVID-19 team at PMH and South Beach Clinic, explains how non-COVID patients are being greatly affected by the pandemic.
We have non-COVID patients in need of care as well as COVID patients. And in our non-COVID patients, they need services such as surgeries, which they're unable to get done. The hospital has been in urgent care mode since March 2020, and there's no sight of this being alleviated anytime soon. We have patients who are waiting for surgeries for months and they cannot get in. Although patients are screened prior to admissions, we are being exposed to positive COVID patients on the ward and are contracting diseases because of this exposure. Our COVID patients require surgical procedures as well. Their surgeries may or may not be related to their COVID infections. We have special protocols in place to reduce staff exposures and cross-contamination.
As it stands, the country has recorded over 19,000 COVID-19 cases and over 400 deaths. For Jcn News, I'm Tyler Simonet.
The Public Hospitals Authority, PHA, responding to that protest staged by some members of the Bahamas Public Services Union, BPSU, on Wednesday just outside the Princess Margaret Hospital. BPSU President Kimsley Ferguson, who joined the small group, threatened the shutdown of the hospital and airports throughout the country if the union's issues aren't resolved. Among the issues, the stalled negotiations of outstanding industrial agreements. Mr. Ferguson lamenting that the union has been trying to get industrial agreements signed for the PHA and the Airport Authority for forever. Well, the PHA in response says the authority remains open to engagement with the BPSU on outstanding issues. The PHA confirming that the proposed industrial agreement between them and the BPSU was approved by the PHA Board of Directors at its monthly meeting on May 19th, and the draft cabinet paper relative to the same was submitted to the Ministry of Health for further action on June 15th. The authority says it awaits the approval of the same or otherwise and is encouraging parties to refrain from making threats to hospital services and patient care in an already challenging environment. You're watching Jcn News. Stay with us.